The needle went in clean. Diane Foster's hand moved without hesitation, angled precisely below the second intercostal space, mid-clavicular line, right into the collapsing chest cavity of the kid sprawled across the hospital parking lot asphalt. The hiss of trapped air escaping sounded like a punctured tire, sudden and sharp in the humid night. The kid gasped. His lips, blue 30 seconds ago, started turning pink again. Someone behind her whispered, "Jesus Christ." Diane pulled the needle out, checked his pulse at the carotid. Steady now, strong. She looked up at the frozen paramedic holding the gurney. "Get him inside, trauma bay 2. Tell them tension pneumothorax, decompressed in field, needs chest tube and imaging." The paramedic blinked. "You're a nurse?" "Yeah." She stood, wiping her hands on her scrubs. "Move." They moved. For more stories like this, make sure you subscribe to Emergency Heroes Stories. 72 hours earlier, Diane had walked into St. Michael's Regional Medical Center, wearing the same expression she'd worn for 12 years in uniform. Eyes down, mouth shut, don't attract attention. The ICU night shift wasn't glamorous. It wasn't supposed to be. That was the point. She adjusted her badge at the security desk. The photo looked wrong. Civilian clothes always looked wrong. First night, the guard, older guy with kind eyes, smiled at her. "Yeah, you'll do fine. It's quieter than days." "Usually." She nodded. Quiet sounded good. Quiet sounded like the opposite of Mosul. The ICU floor smelled like antiseptic and stale coffee. Fluorescent lights buzzed overhead, casting everything in that particular shade of hospital white that made everyone look half dead. Diane found the nurse's station, introduced herself to the charge nurse, and started reviewing charts. Her hands moved across the keyboard efficiently, muscle memory from 1,000 digital field reports. She caught herself and slowed down. Civilians didn't type like they were filing combat after-action reviews. "You're the new hire?" Diane looked up. The man standing over her wore surgical scrubs and an expression that said he'd already decided she wasn't worth his time. Tall, graying at the temples, with the kind of posture that came from decades of people getting out of his way. "Yes, sir." Diane Foster. "Dr. Gerald Whitmore, Chief of Surgery." He glanced at her screen, then back at her face. "You come from another hospital?" "No, sir. Recently certified." His eyebrow went up. "You're older than most new grads." "Career change." "From what?" "Government work." He waited for elaboration. She didn't offer any. His mouth tightened slightly, the way people's mouths do when they're used to getting answers and don't. "Well, Miss Foster, night shift ICU is straightforward. Monitor vitals, administer medications as ordered, call the attending if anything changes. Don't make decisions above your pay grade." He tapped the desk once, a punctuation mark. "Clear?" "Crystal." He walked away. Diane went back to her charts. The charge nurse, a woman named Pan, with 2 decades of experience written in the lines around her eyes, leaned over. "Don't take it personally. Whitmore's like that with everyone new, especially nurses." "Noted. You really come from government work?" "Something like that." Pam studied her for a moment, then shrugged. "Well, welcome to St. Michael's. If you need anything, holler." The first 4 hours passed uneventfully. Diane made her rounds, checked IVs, adjusted medication drips, logged vitals. She moved through the tasks with practiced efficiency. Each motion economical, no wasted movement. Old habits. Around 2 in the morning, she was checking on a post-op patient in room 12 when she noticed the IV insertion site. Slight redness, warmth to the touch, early signs of phlebitis. The insertion angle was wrong. Whoever placed it had gone too shallow, irritating the vein wall. She pulled it, placed a new line higher up the arm, proper angle, smooth insertion. 30 seconds, no complications. The patient, an older woman recovering from gallbladder surgery, barely stirred. Diane logged the change and moved on. Behind her, in the hallway, Dr. Marcus Liu paused mid-step. He'd been walking past, headed for the break room. When he'd glanced through the open door and seen the IV replacement, the angle, the speed, the way her hands moved with absolute certainty in the dark room, that wasn't normal. He knew nurses, good ones, experienced ones, the kind who could run a code in their sleep. But that insertion technique, that particular economy of motion, the way she'd checked the site with 2 fingers, like she was assessing battlefield trauma, not routine phlebitis. He filed it away and kept walking. Morning rounds. Diane had been awake for 20 hours straight. It didn't show. Sleep deprivation was a skill you learned, same as triage or tourniquet application. She stood at. Sitting at the back of the group as Dr. Whitmore led 4 residents through the ICU, reviewing cases, asking questions, making pronouncements. Diane kept her eyes on her tablet, taking notes. They stopped outside room 8. Mr. Abrams, 71, 3 days post-op from coronary bypass. Stable vitals, normal recovery trajectory according to the chart. Whitmore addressed the residents. Post-operative day 3, no complications, on track for discharge tomorrow. Questions? One of the residents, young guy with eager eyes, asked about anticoagulation protocols. Whitmore answered, thorough and precise. Diane looked at the monitor, then at Mr. Abrams through the window. Something was off. Nothing she could name, just a rawness in the air. His color was fine, vitals were fine. But the way he was breathing, shallow and careful, like each breath hurt. She stepped forward. Dr. Whitmore? He turned, mid-sentence, irritation flickering across his face. Yes, I think we should get a chest X-ray on Mr. Abrams. Silence. The residents looked at her, then at Whitmore. Based on what? His tone was flat. Respiratory pattern. He's guarding. Possible fluid accumulation. His vitals are stable. Oxygen saturation is 97%. Lung sounds were clear this morning. Whitmore's voice dropped into that particular register of condescension reserved for people who've overstepped. You're a nurse, not a physician. Your opinion wasn't requested. Diane held his gaze for 2 seconds, then looked down. Understood. Whitmore turned back to the residents. As I was saying, anticoagulation balance is critical in the first week post-op. They moved on. Dr. Liu, standing at the edge of the group, glanced back at Diane. She was still watching Mr. Abrams through the window, her expression unreadable. He'd seen that look before. In EMTs who'd worked too many scenes. In paramedics who could smell death before it arrived. Back at the nurse's station, Pam refilled her coffee. You really think Abrams has something? Yeah. Whitmore didn't seem to think so. Diane didn't respond. She pulled up Mr. Abrams' surgical notes, post-op imaging, pre-op workup. Everything looked textbook. But textbooks didn't account for the 10,000 variables that separated theory from reality. She'd learned that in Kandahar. Watching a routine patrol turn into a bloodbath because someone ignored the feeling that something was wrong. Pam watched her. You got good instincts? Sometimes. Well, keep an eye on him. If something changes, call it. Diane nodded. If you want to see how Diane's instincts save a life everyone else missed, make sure you subscribe. Because what she does in the next few hours will leave even the chief of surgery speechless. Where are you watching from? Drop a comment below. The shift change happened at 7. Diane gave report to the day nurse, logged out and headed for the parking lot. The sun was already climbing, turning the asphalt into a griddle. She sat in her car for 5 minutes, hands on the steering wheel, not moving. 12 years of moving, always moving. Convoys, medevacs, field hospitals packed into shipping containers. If you stopped moving, you started thinking. Thinking was dangerous. She started the engine and drove home. The locker room smelled like industrial soap and old coffee. Diane pulled her scrubs from her bag. 3rd night in a row, same routine. She could hear voices around the corner, near the sinks. 2 of the day shift nurses, ending their rotation. Did you see the new night nurse, Foster? Yeah, quiet. Intense. Pam said she replaced an IV in the dark like she had night vision or something. A laugh. Maybe she's just good at her job. Nobody's that good 3 days in. And did you see how she stands? Like she's waiting for someone to attack her? Military maybe. She said government work. Could be anything. DMV, post office. Another laugh, softer this time. I don't know. Something about her feels off. Not bad off. Just different. Diane waited until they left before walking to her locker. Different was the goal. Different meant no one asked questions. She changed, tied her hair back, checked her phone. No messages. There were never messages. The ICU was busier tonight. 2 fresh post-ops, 1 trauma transfer from the smaller hospital, and Mr. Abrams still in room 8. Diane checked his chart first thing. Vitals stable, no changes, no X-ray ordered. She walked to his room. He was awake, watching television with the sound off. When she entered, he turned his head slowly, like the movement took effort. "Evening, Mr. Abrams. How are you feeling?" "Tired." His voice was thin. "Hurts when I breathe deep." Diane moved to his bedside, placed 2 fingers on his wrist, checking pulse manually, even though the monitor displayed it perfectly. Old habit. Machines lied sometimes. Skin didn't. Scale of 1 to 10. How bad's the pain? "Maybe a 5, 6. Icks when I cough." She pressed gently on his chest, watching his face. He winced slightly on the left side, just below the sternum. "When did it start hurting?" "This morning. They said it was normal. Post-surgery soreness." Diane nodded, keeping her expression neutral. She listened to his lungs with her stethoscope. Diminished sounds on the left lower lobe. Faint, but there. She checked the monitor again. Oxygen saturation 96%. Heart rate 78. Blood pressure 120/80. Everything looked fine. Everything wasn't fine. "I'm going to let the doctor know," she said, "just to be safe." Mr. Abrams nodded and went back to his silent television. Diane found Dr. Whitmore in the physician's lounge, reviewing labs on a tablet. She knocked on the doorframe. He looked up, and she watched recognition followed by mild irritation cross his face. "Mr. Abrams in room 8, she said. "He's reporting increased chest pain. Left-sided, worse with inspiration. Diminished breath sounds lower left lobe." Whitmore set down his tablet. "His vitals? Stable. Oxygen saturation? 96%. So within normal range for a post-op patient." He picked up his coffee. "Post-surgical pain is expected, Miss Foster. You don't order imaging every time someone reports discomfort. It's been 3 days. His body is healing. His pain is localized and new onset today. And his vitals are stable." Whitmore's tone flattened. "I reviewed him this morning personally. Lung sounds were clear. Unless there's a significant change in objective measurements, we monitor and manage pain appropriately." Diane held his gaze. "I think we should get a chest x-ray." "Your opinion is noted." He stood, picking up his tablet. "But I'm the attending physician, and I'm telling you his presentation doesn't warrant imaging. If his saturation drops below 94 or he develops respiratory distress, page me. Otherwise, continue current care plan." He walked past her, close enough that she had to step aside. She stood in the empty lounge for 5 seconds, then returned to the nurse's station. Dr. Liu was there, updating a chart. He glanced at her. "Whitmore shut you down?" "Yeah, he does that." Liu clicked his pen, thoughtful. "You really think Abrams has something?" "Yeah." "Based on what?" "I looked at his chart. Everything's textbook." Diane pulled up the monitor feed on her screen, showing Mr. Abrams' room. He was sitting up now, leaning slightly forward, one hand pressed to his chest. "Look at his posture. He's tripoding. And his breathing rate just went from 16 to 22 in the last 10 minutes. Liu leaned in, studying the screen. "Still within range. It's the trend, not the number." He looked at her. "You've seen this before." It wasn't a question. "Yeah." "Where'd you work before this?" "Overseas." "Military?" She didn't answer. Liu waited, then shrugged. "Well, for what it's worth, I think your instincts are probably right. But Whitmore's not going to order imaging unless something objective changes. That's just how he operates. So we wait for him to crash. We monitor closely and hope he doesn't." Liu stood. "I'll keep an eye on him too. If anything shifts, we'll push harder." Diane nodded. It wasn't enough, but it was something. The night crept forward. Diane made her rounds, administered medications, checked and rechecked Mr. Abrams every 20 minutes. His respiratory rate climbed to 24. Then 26. Oxygen saturation held at 96. Then 95. Still within parameters. Still wrong. At 11:43, the monitor alarm went off. Diane was at the nurse's station, documenting notes, when the sound cut through the low hum of the ICU. She knew which room before she looked at the screen. Room 8. She moved fast, not running but close. By the time she hit the doorway, Mr. Abrams was sitting bolt upright, gasping, one hand clutching his chest, eyes wide with panic. Oxygen saturation, 89% and dropping. Blood pressure, 60/30. Heart rate 140 and climbing. Diane hit the code button and moved to his bedside. "Mr. Abrams, look at me. I need you to stay calm." He couldn't answer. His lips were turning blue. She increased oxygen flow to maximum, placed her hand on his chest, felt the asymmetry immediately. Left side wasn't moving right. Muffled heart sounds. Jugular veins distended. Cardiac tamponade. Blood was filling the pericardial sac, squeezing his heart like a fist. Every beat pushed more fluid into the space, less room for the chambers to fill. Pressure building until the whole system collapsed. He had minutes. The code team arrived. Whitmore behind them, still pulling on gloves. He took one look at the monitor and swore under his breath. What happened? His voice was sharp. Sudden onset respiratory distress, hypotension, distended jugular veins. Diane stepped back. CK giving him room. I think it's cardiac tamponade. Whitmore moved to the bedside, stethoscope out, listening. His face went rigid. Get a crash cart. Page cardiothoracic. We need an OR now. He won't make it to the OR. Diane's voice was calm, flat. The way it used to sound over comms when everything was on fire and calm was the only thing keeping people alive. Whitmore turned. Excuse me? He's decompensating too fast. Blood pressure's dropping. He needs pericardiocentesis now. That's not your call to make. Mr. Abrams gasped, a horrible wet sound. The monitor screamed. Blood pressure 50/20. Oxygen saturation 83%. Diane looked at Whitmore. You have about 90 seconds before he arrests. I can do the procedure. You're a nurse. I've done it 16 times. The room went quiet except for the alarms. Everyone stared at her. Whitmore's face cycled through confusion, anger, disbelief. Mr. Abrams went limp. The monitor flatlined. He's coding, someone shouted. Diane didn't wait for permission. She grabbed the crash cart, pulled out an 18-gauge spinal needle, betadine swab, and moved to the bedside. Someone started compressions. She positioned herself below the xiphoid process, swabbed the site in 2 seconds, angled the needle 45 degrees toward the left shoulder. Stop compressions. They stopped. She pushed the needle in, steady pressure, feeling for the give. 4 centimeters, 5. The hub filled with dark blood. Aspirating now. She pulled back on the syringe. 20 milliliters, 30, 40. The blood came thick and fast, pressure releasing. The monitor beeped. Once, twice, rhythm returning. Mr. Abrams gasped, a full breath this time, and his eyes opened. Diane pulled the needle out, applied pressure, kept her eyes on the monitor. Blood pressure climbing, 60/40, 70/50. Oxygen saturation 88, 89, 92. He was back. She looked at Whitmore. He needs surgical repair, but he'll make it to the OR now. Whitmore stared at her, mouth slightly open, and for the first time since she'd met him, he had absolutely nothing to say. The surgical team took Mr. Abrams 10 minutes later. Diane watched them wheel him out, his vitals stable now, color returning to his face. He squeezed her hand as they passed. No words. He didn't have the breath for them yet. She stood in the hallway, still wearing gloves sticky with betadine and blood, while the code team dispersed. No one spoke to her. They just looked, quick glances, then away. Dr. Liu appeared beside her. Where the hell did you learn to do that? Training. What kind of training? She peeled off the gloves, dropped them in the biohazard bin. The kind you get when people are dying and there's no time for an OR. He stared at her. You were military. It wasn't a question this time either. Diane walked back to the nurse's station without answering. Her hands were steady. They were always steady doing. It was after that things got complicated. She logged the procedure, clinical and precise. Time of code, interventions performed, volume aspirated, patient response. The words looked sterile on the screen. Nothing like the reality of a man's heart stopping in front of her. Pam came over, holding 2 cups of coffee. She set one down in front of Diane. You just saved his life. Maybe. No maybe about it. Pam sat down. I've been doing this 23 years. I've never seen a nurse perform a pericardiocentesis. Didn't even know it was possible outside an OR. It's not supposed to be. But you've done it before. Yeah. Pam sipped her coffee, studying Diane over the rim. You're going to have to talk to Whitmore. He's in his office. Probably figuring out whether to thank you or fire you. Both, probably. Probably. Pam smiled, tired but genuine. For what it's worth, you did the right thing. Protocol doesn't mean much when someone's dying in front of you. Diane drank the coffee. It was terrible, burnt and bitter, exactly like every field hospital she'd ever worked in. Somehow that made it better. Dr. Liu sat down across from her. He pulled up Mr. Abrams' chart on his tablet, scrolling through the pre-op imaging. Look at this. Small pericardial effusion noted on pre-surgical echo. Trace amount. Considered clinically insignificant. Diane leaned over. The image showed a thin, dark line around the heart, barely visible. Post-op bleeding into an existing effusion, Lou continued. It was already there. The surgery just made it worse. You called it 12 hours before he crashed. Whitmore didn't think so. Whitmore was wrong. Lou set down the tablet. And he knows it. That's going to be a problem for him. Why? Because admitting a nurse was right and he was wrong goes against everything he believes about how hospitals work. Lou leaned back. You just disrupted the hierarchy. That's dangerous. More dangerous than letting someone die? In his world, maybe. Diane finished her coffee. The ICU had returned to its usual quiet hum. Monitors beeping, ventilators cycling, the soft shuffle of nurses moving room to room. Normal. Except nothing felt normal anymore. She'd tried so hard to disappear. Keep her head down. Do the job. Don't stand out. 3 days. She'd lasted 3 days. At 1 a.m, Diane knocked on Dr. Whitmore's office door. He looked up from his desk, face unreadable, and gestured for her to enter. She closed the door behind her. The office smelled like old books and stale air. Framed diplomas covered one wall. 20 years of credentials, awards, certifications. Proof of authority. Whitmore took off his reading glasses. Sit. She sat. For a long moment, he just looked at her. Then he said, that procedure you performed, pericardiocentesis under emergency conditions. Where did you learn it? Overseas. That's not an answer. It's the one I'm giving. His jaw tightened. You're a registered nurse with a civilian certification that's less than a year old. Your background check came back clean. No prior medical employment. Nothing. And yet you just performed a procedure I've seen go wrong in the hands of experienced cardiologists. Diane said nothing. So I'll ask again, Whitmore continued, voice dropping. Where did you learn emergency pericardiocentesis? And don't tell me nursing school. I worked in high-pressure environments. People got hurt. I learned what I needed to learn to keep them alive. What kind of environments? The kind where if you waited for the right person with the right credentials, everyone died. Whitmore leaned forward. Military. You were military. I was a lot of things. Are you even qualified to work here? My nursing license is valid. I passed every certification exam. I'm legally allowed to work in this ICU. Diane met his eyes. And I just saved a patient's life because I didn't wait for permission. You exceeded your scope of practice. I kept a man's heart beating. That's not the point. Then what is? Whitmore stood, turned toward the window. Outside, the parking lot stretched empty under sodium lights. The point is that hospitals have rules, hierarchies, protocols. Those things exist for a reason. When people start ignoring them, even with good intentions, the system breaks down. The system was about to let Mr. Abrams die. We would have gotten him to the OR. He coded before the surgical team even arrived. You know he wouldn't have made it. Whitmore didn't respond. Diane stood. Am I fired? He turned back to face her. I don't know yet. I need to review what happened with administration. Performing an invasive procedure without physician orders, even in a code situation, is complicated legally. Understood. You're suspended pending review. Go home. We'll contact you in 48 hours. Diane nodded and walked to the door. Miss Foster. She stopped, hand on the doorknob. That man is alive because of you. Whitmore's voice was quieter now, almost reluctant. I want you to know I recognize that, even if I don't know what to do with it. She left without answering. The locker room was empty. Diane changed slowly, folding her scrubs, placing them in her bag. Her phone buzzed. Text from Pam. Heard you got suspended. That's bullshit. Call me if you need anything. She didn't respond. Outside, the night air was thick and warm. Diane sat in her car, windows down, not starting the engine. Somewhere in the distance, an ambulance siren wailed. The sound triggered something, a flash of memory. Mosul, the smell of smoke and copper. Someone screaming for a medic. She closed her eyes and breathed through it. 5 seconds in, 7 seconds out. The way they'd taught her in therapy before she left active duty. It didn't help much. Her phone buzzed again. Different number this time. Unknown. She almost didn't answer. Then something made her thumb the screen. Foster. Captain Foster? The voice was male, unfamiliar, cautious. She went very still. Who is this? This is Sergeant First Class Deshaun Carter. We served together. 75th Regiment, Afghanistan, 2016. Diane's hand tightened on the phone. How did you get this number? I'm in St. Michael's Emergency Department. Motorcycle accident. Busted femur. They're prepping me for surgery. He paused. I saw you on the ICU floor earlier. Wasn't sure it was you at first, but then I heard what you did tonight. Pericardiocentesis in a code. That's pure Ranger medic. Carter, I'm not. I know you're not supposed to be here. I know you left. I'm not going to blow your cover. His voice softened. I just wanted to say it's good to see you alive. A lot of us wondered what happened after Mosul. Diane leaned her head back against the seat. I'm fine. You don't sound fine. I'm managing. Yeah. Yeah. I remember that's what you always said. A pause. Listen, I'm about to go under. But if you ever want to talk about anything, I'm around. Recovering here for at least a week. Carter, you saved my life twice in Kandahar. Figure I owe you at least a conversation. The line went quiet. Then, take care of yourself, Captain. He hung up. Diane sat in the silence, phone still pressed to her ear. Captain, she hadn't heard that word in 8 months. Hadn't wanted to hear it ever again. She started the engine and drove home through empty streets, trying not to think about how 3 days of hiding had just collapsed into nothing. Diane spent 2 days in her apartment, waiting for a phone call that would decide whether she still had a job. The space was small, mostly empty. A couch she'd bought at a thrift store. A table with 1 chair. Walls bare, except for a single photograph she kept meaning to hang, but never did. She ran every morning. 6 miles. Same route, pushing until her lungs burned and her legs ached. Pain was clarifying. Pain kept the memories at bay. On the second afternoon, her phone rang. Hospital administration. Miss Foster, this is Christine Vega. I'm the hospital administrator at St. Michael's. We need you to come in for a meeting tomorrow morning, 9 o'clock. Dr. Whitmore will be present, along with our legal counsel. Am I being terminated? A pause. We'll discuss your status tomorrow. The line went dead. Diane set the phone down and stared at the ceiling. She'd known this was coming. You couldn't break protocol even to save a life, without consequences. That was the civilian world. Rules mattered more than results. She should have stayed invisible. The next morning, Diane arrived at the hospital at 8:45, wearing civilian clothes that felt like a costume. Slacks, button-down shirt, her hair pulled back. She looked like someone applying for a loan, not fighting for her career. Christine Vega's office was on the 3rd floor, all glass and polished wood. The kind of space designed to intimidate. Vega herself sat behind a massive desk, mid-40s, sharp-eyed, wearing a suit that probably cost more than Diane made in a month. Dr. Whitmore sat to the side, expressionless. A third person, a man in his 50s with a briefcase, introduced himself as the hospital's legal counsel. Foster, thank you for coming. Vega gestured to an empty chair. Please sit. Diane sat. Vega opened a folder. We completed our review of the incident involving patient Gerald Abrams. You performed an emergency pericardiocentesis without physician orders during a code situation. That procedure is outside the scope of practice for a registered nurse in this state. The patient was dying. The patient was receiving appropriate code protocols, the lawyer interjected. Compressions had been initiated. A physician was present. The physician wasn't moving fast enough. Whitmore's jaw tightened, but he said nothing. Vega continued. Your actions, while arguably effective in this instance, represent a significant liability for this hospital. If something had gone wrong, if Mr. Abrams had died or suffered complications from your intervention, we would be facing a lawsuit we couldn't win. But he didn't die. That's not the point. Vega leaned forward. The point is, you exceeded your authority. You made a clinical decision that wasn't yours to make. And in doing so, you put this institution at risk. Diane looked at Whitmore. Do you think I was wrong? He met her eyes. I think you violated protocol. That's not what I asked. Silence stretched between them. Finally, Whitmore said, "No, I don't think you were wrong, but that doesn't change the fact that what you did was outside your scope." Vega closed the folder. "We're terminating your employment, effective immediately. You'll receive 2 weeks severance pay. Your hospital credentials will be deactivated as of this afternoon." Diane nodded slowly. She'd expected this, prepared for it. "So why did it feel like something breaking? Do I get to say anything?" "If you'd like." Diane stood. "I've spent 12 years keeping people alive in situations where there were no rules, no protocols, just bleeding and dying and trying to hold the line. I came here because I thought civilian medicine would be different. Cleaner, safer. But it's not. It's just slower." She looked at Vega, then at Whitmore. "That man is alive because I didn't wait for permission. If that's a fireable offense, then I don't want to work here anyway." She walked to the door. "Miss Foster." Whitmore's voice stopped her. "For what it's worth, you're a hell of a nurse. I hope you find a place that deserves you." She left without responding. Diane made it to the parking lot before her hands started shaking. She sat in her car, gripping the steering wheel, breathing through the tightness in her chest. It wasn't fear, the same rage she'd felt in Mosul, when command had overridden her medical judgment and people had died because of it. Rules. Always the rules. Even when the rules killed people. Her phone buzzed. "Unknown number again." She answered. "What?" "Captain Foster, this is Lieutenant Colonel Davis, Defense Health Agency. Do you have a moment?" Diane went very still. "How did you get this number?" "We've been tracking your transition to civilian life. Standard protocol for personnel with your clearance level." A pause. "I understand you were just terminated from St. Michael's Regional Medical Center." Word travels fast. "We maintain relationships with certain institutions. When someone with your background makes waves, we hear about it." Davis's tone shifted. "I'm calling because we have a situation. Mass casualty incident developing. Construction site collapse, downtown, about 6 blocks from your location. Multiple critical casualties incoming to St. Michael's. They're about to be overwhelmed. I don't work there anymore." "I know, but they're going to need you anyway." Diane closed her eyes. "I'm done, Colonel. I left for a reason." "People are dying, Captain. That's not my problem anymore." "Isn't it?" The line went dead. Diane sat there, phone in hand, while sirens began wailing in the distance. 1, then 2, then half a dozen, converging from every direction, all headed toward the hospital behind her. She could leave, drive away, let someone else handle it. She started the engine and sat there, not moving, while the sirens grew louder. Inside the hospital, chaos was unfolding. The first ambulance arrived at 9:23, carrying a 19-year-old construction worker named Ryan Sadowski, with 3 feet of rebar impaled through his right chest. 2 minutes later, 3 more ambulances, then 4 more. The emergency department transformed into controlled pandemonium. Every available staff member converged on the trauma bays. Dr. Whitmore, still in his office after the termination meeting, heard the overhead alert and moved immediately. Trauma alert. Mass casualty incident. All available physicians to emergency department. Repeat. All available physicians to emergency department. Dr. Liu was already there, hands moving fast, triaging as patients rolled in. Crushed limbs, punctured lungs, internal bleeding. One patient, DOA, rushed past toward the morgue. Whitmore grabbed a resident. "What happened?" "Construction site. Steel beam collapsed. At least 12 casualties, 6 critical." Whitmore scanned the room. Every bed filled. Nurses running between patients. Not enough hands. Not nearly enough. Liu appeared beside him, blood on his scrubs. "We need more surgical staff." Ryan Sadowski, 19 years old, rebar through right chest. "It's close to the pulmonary artery. He needs surgery now, but we don't have an open OR. Stabilize him here, we'll get him up as soon as possible." "He won't last that long. He's already showing signs of tamponade." Whitmore moved to the bedside. The kid was pale, conscious but terrified, breathing in shallow gasps. The rebar entered just below his clavicle, exited near his scapula. Imaging would tell them exactly what it had hit, but there was no time for imaging. "BP 70/40 and dropping," a nurse called out. Whitmore checked the monitor. "Start pressors. Get cardiothoracic down here now." Another resident ran up. Dr. Whitmore, bed 3 needs you. Abdominal bleeding, unstable. He looked between the two patients. Not enough of him. Not enough of anyone. In the chaos, no one noticed the woman in civilian clothes walking through the emergency department doors. Diane moved through the crowd like water, silent and sure, taking in everything. The kid with the rebar, the elderly man with crush injuries, the woman coding in bed 5. She saw Dr. Liu, recognized the expression on his face. Overwhelmed, drowning. She walked to the nurse's station, grabbed a pair of scrubs from the supply closet, and changed in 30 seconds. When she emerged, she tied her hair back and moved to Ryan Sadowski's bedside. Lou saw her and froze. "Foster, what are you? Where do you need me?" "You were fired. I'm here anyway." "Where do you need me?" He stared at her for 2 seconds, then pointed at Ryan. "Keep him alive. Whitmore's trying to get him to an OR, but there's a wait." Diane looked at the monitor. Blood pressure dropping, respiratory rate climbing, the rebar shifting slightly with each breath. One wrong move and it would sever the pulmonary artery completely. She'd seen this before. Fallujah. Different weapon, same problem. "He's not going to make it to an OR," she said quietly. Lou's face went pale. "What?" "Look at his vitals. He's decompensating. The rebar is already causing vascular compromise. Every minute we wait, he gets closer to exsanguination." "So what do we do?" Diane placed her hand on Ryan's shoulder. The kid looked up at her, eyes wide with fear. "You're going to be okay," she told him. Then she looked at Lou. "I need to stabilize him here, now." "How?" Before she could answer, a voice cut through the noise. "Captain Foster?" She turned. Standing in the doorway, leaning on crutches, wearing a hospital gown and a cast on his right leg, was Sergeant First Class Deshaun Carter. He stared at her, then at the organized chaos around her, then back at her face. "Holy hell," he said quietly. "You're doing it again." Carter hobbled closer, navigating through the chaos on his crutches with practiced efficiency. He stopped at the edge of Ryan Sadowski's bed, eyes moving from the rebar to Diane's face. "That's a bad one, Captain." Diane didn't look at him. "You should be in your room." "Heard the alert. Figured I'd see if you were here." He nodded toward Ryan. "Looks like Ramadi. Kid caught shrapnel through the chest. You pulled him out." "That was different." "Not that different." Dr. Liu looked between them, confusion written across his face. "You two know each other?" 75th Ranger Regiment, Carter said. "She was our combat medic. Best one we ever had." Liu's eyes widened. "You were a Ranger medic?" Diane kept her focus on Ryan's monitor. Blood pressure 68/38. Heart rate 140. Respiratory rate 32. The kid was circling the drain. "Lou, I need a portable ultrasound, now." He hesitated for half a second, then moved. Carter leaned on his crutches, watching her work. "What's the play?" "Same as always. Keep him breathing until I can get him definitive care. That rebar's sitting on something important." "Yeah." "You know which something?" "Not until I get imaging." Lou returned with the ultrasound machine. Diane powered it up, placed the probe on Ryan's chest, angling carefully around the rebar. The screen flickered to life, showing grainy black and white images of tissue, bone, and metal. She moved the probe slowly, mapping the trajectory. The rebar had entered just below the clavicle, passed between the second and third ribs, missed the subclavian artery by millimeters, and come to rest less than 2 centimeters from the right pulmonary artery. "Jesus," Lou whispered. "Yeah." Diane set down the probe. "He needs surgery, but if we move him, that rebar shifts and he bleeds out in the elevator." "So what do we do?" Diane looked at Ryan. The kid was fading, eyes struggling to focus. She placed her hand on his forehead, the way she used to, with wounded soldiers who were too young to be where they were. "Stay with me, Ryan. I'm going to fix this." He managed a weak nod. She turned to Lou. "Get Whitmore, now." Lou disappeared into the chaos. Diane used the time to establish better IV access, increasing fluid resuscitation, preparing for the impossible thing she was about to suggest. Whitmore appeared 2 minutes later, scrubs soaked with someone else's blood, exhaustion written in the lines around his eyes. When he saw Diane, he stopped cold. "What are you doing here?" "Keeping this kid alive. You were terminated this morning." "I know. Are you going to argue about it, or are you going to listen?" Whitmore's jaw tightened, but he moved to the bedside. "What's the situation?" "Rebar impalement, close proximity to right pulmonary artery. He's hypotensive, tachycardic, and deteriorating. He won't survive transport to an OR." Whitmore looked at the ultrasound images Lou pulled up. His face went pale. That's impossible to stabilize here. No, it's not. Ms. Foster, Captain Foster. Carter's voice cut through. He'd moved closer, standing at Diane's shoulder. She's a captain, U.S. Army, 12 years in special operations. And I've personally watched her perform field surgery under mortar fire that would make your OR look like a spa. Whitmore stared at Carter, then at Diane. Your military? Was. What kind of military has nurses performing field surgery? The kind where if you don't, everyone dies. Diane pulled up Ryan's monitor readings. His blood pressure's dropping. We have maybe 10 minutes before he arrests. I can stabilize the rebar in situ, control any bleeding, and get him stable enough for transport. But I need your authorization. You're asking me to let you perform surgery in an emergency department bay. I'm telling you, it's his only chance. Whitmore looked at Ryan, then at the monitor, then back at Diane. She could see the war happening behind his eyes. Protocol versus reality, hierarchy versus necessity. You've done this before, he said quietly. 87 times. In combat. In situations where there was no other option. Same as now. A long silence. Then Whitmore turned to Lou. Get me a surgical kit, chest tube tray, vascular clamps, and clear everyone who doesn't need to be here. Lou moved fast. Whitmore looked at Diane. If this goes wrong, it won't. You can't promise that. No, but I can promise that if we don't try, he dies. So you tell me which risk you'd rather take. Whitmore held her gaze for 3 seconds, then stepped back. He's yours. Diane nodded and turned to Ryan. The kid's eyes found hers, terrified and pleading. Ryan, listen to me. I'm going to stabilize that rebar so it doesn't move. It's going to hurt, but I need you to stay as still as possible. Can you do that? Yeah. His voice was barely a whisper. Good. I need you to trust me. I've done this before. You're going to be okay. Lou returned with the surgical equipment. Diane pulled on sterile gloves, arranged her instruments with swift precision. Scalpel, hemostats, clamps, gauze, chest tube. Everything she'd need to control disaster if it happened. Carter moved closer. You need an extra set of hands? You're supposed to be non-weight-bearing on that leg. I can stand for 10 minutes. She looked at him, saw the same expression he'd worn in Kandahar when she'd asked him to hold pressure on a femoral bleed while she worked on another casualty. Steady, unshakable. Okay, stand on his left side. If I call for clamps, you hand them to me. Fast. Yes, ma'am. Diane positioned herself at Ryan's right side, examining the entry wound. The rebar had punched through skin, muscle, and bone, creating a tract of damaged tissue. Blood oozed around the edges, not enough to be arterial, but steady. She looked at Lou. I need you to monitor his vitals. Any change, you call it immediately. Got it. Whitmore, you're backup. If I can't control bleeding, you take over. He nodded, face grim. Diane took a breath, let it out slowly. The emergency department noise faded to background static. Everything narrowed to Ryan's chest, the rebar, and her hands. She'd been here before. Different country, different war, same moment of absolute clarity. Starting now. She made her first incision, extending the entry wound, giving herself room to work. Blood welled up. She suctioned it away, exposing the damaged tissue beneath. The rebar had fractured the second rib on entry, fragments embedded in the surrounding muscle. Removing bone fragments, she said, voice calm and clinical. Her hands moved with mechanical precision, extracting pieces of rib, clearing the field. Ryan gasped, biting back a scream. I know, Diane said quietly. Stay with me. She packed gauze around the rebar, stabilizing it, preventing any shift. Then she used her fingers to trace the metal's path, feeling for the pulmonary artery, for any sign of active bleeding. There, a small tear in the arterial wall, oozing blood. Not ruptured yet, but close. I need a vascular clamp, she said. Carter had it in her hand before she finished the sentence. She applied the clamp with exquisite care, occluding the damaged section of artery. The bleeding stopped. Vitals? She asked. Blood pressure 70/42, Lou called. Heart rate 138, holding stable. Not good, but better. Diane used hemostats to secure the rebar to the surrounding tissue, creating a stable construct that wouldn't shift during transport. It wasn't elegant, but it was functional. Chest tube next, she said. He's got a pneumothorax developing from the rib fracture. She made a second incision, lower and lateral, inserted the tube with practiced efficiency. Air hissed out, then blood. She connected it to suction. Ryan's oxygen saturation climbed from 89 to 94%. Better, Lou said, awe in his voice. Diane stepped back, surveying her work. The rebar was stabilized, bleeding controlled, pneumothorax treated. Ryan's vitals were tenuous, but holding. She looked at Whitmore. He's ready for transport now. But the OR team needs to know that rebar can't be removed until they have vascular repair capabilities standing by. The clamp is temporary. Whitmore nodded, already reaching for his phone. I'll call upstairs. Diane stripped off her gloves. Her hands were covered in blood. So was her borrowed scrub top. She looked at Ryan. His eyes were open now, focused on her face. You're going to be okay, she told him. Who are you? He whispered. Someone who's seen this before. Carter smiled. That's the understatement of the century, kid. The OR team arrived, transferred Ryan to a gurney with exquisite care, and rushed him toward the elevators. Diane watched them go, feeling the adrenaline start to drain, leaving exhaustion in its wake. Lou stood beside her, staring. That was the most insane thing I've ever seen. That was field medicine. You learned that in the Army? I learned that because people kept bleeding, and I didn't have any other options. Whitmore approached slowly. His expression was unreadable. Miss Foster, Captain Foster, we need to talk. About what? About who you really are. The emergency department had quieted. Not silent, never silent in a hospital, but the initial wave of chaos had passed. Most of the construction accident victims were either in surgery or stabilized in the ICU. The rest of the staff moved like ghosts, exhausted and running on muscle memory. Diane stood at a sink, scrubbing blood from her hands. The water ran pink, then clear. She watched it circle the drain, feeling the familiar hollowness that came after. The adrenaline crash. The moment when your body remembered it was supposed to be afraid. Whitmore appeared beside her. He didn't speak immediately, just stood there, waiting. She turned off the water. Say what you need to say. Not here. He glanced around. My office. 5 minutes. He walked away before she could argue. Carter was sitting in a wheelchair now, leg elevated, but still present. He rolled closer. You good, Captain? Don't call me that. Old habits. He studied her face. You did good work today. That kid's alive because of you. He's alive because I got lucky. Luck had nothing to do with it. That was skill, training, experience. He paused. How long you been trying to hide who you are? 8 months. How's that working out? She looked at him. Not great. Yeah, I figured. He adjusted his cast. For what it's worth, whoever you were trying to become, I think she just left. The woman who did that. He nodded toward the trauma bay. That's Captain Diane Foster, Ranger Medic. Whether you want to be her or not. Diane didn't respond. She walked toward Whitmore's office, feeling the weight of every eye tracking her movement. The nurses, the residents, even the patients who were conscious. Everyone watching the woman who just performed surgery in an emergency department and made it look routine. Whitmore's office door was open. She stepped inside. He closed it behind her with a soft click that felt ominous. Sit, he said. She remained standing. He sighed, moved behind his desk, pulled something from a drawer. A file folder. He set it down, opened it. Inside were pages of text, some portions redacted with thick black lines. After you left this morning, I made some calls, Whitmore said. Called a colleague at Walter Reed. Asked if he'd ever heard of a combat medic named Diane Foster. Her jaw tightened. He hadn't, but he knew someone who might. That person made another call. Eventually, about an hour ago. I got a phone call from a Lieutenant Colonel Davis at the Defense Health Agency. Whitmore looked up. He told me that asking questions about you was complicated, that your service record is partially classified, that I should be very careful about what I say and to whom. Diane said nothing. So I'm going to ask you directly, and I want the truth. Whitmore's voice was quiet but firm. Who are you? She met his eyes. For 8 months, she'd avoided this moment, deflected, evaded, kept the wall up. But the wall was gone now, blown apart the moment she'd touched Ryan Sadowski's chest. Captain Diane Foster, U.S. Army Medical Corps, 75th Ranger Regiment Medical Detachment, 12 years active duty. The words came out flat, clinical. 3 deployments, Afghanistan, Iraq, Syria. 847 combat medical interventions, specialized in tactical combat casualty care and forward surgical team operations. The room went silent. Whitmore stared at her. You were a ranger. I was a medic attached to rangers. There's a difference. Not much of one. He leaned back in his chair. Special operations. That means you saw things most military physicians never see. Yeah. The procedures you've performed here, pericardiocentesis, emergency thoracotomy with rebar stabilization, those aren't standard civilian nursing techniques. No, they're battlefield techniques, damage control surgery. You do what you have to do to keep someone alive long enough to get them to definitive care. Whitmore was quiet for a long moment. Then he asked, "Why didn't you tell us?" "Because I didn't want to be that person anymore." "What person?" Diane looked away, toward the window. Outside, an ambulance sat idle, lights off. The person who makes life and death decisions under fire. The person who decides who gets treated first, who can wait, who's already gone. The person who carries the weight of every choice, every face, every name. She turned back to him. I wanted to be a nurse, take orders, follow protocols, care for patients without having to decide if they live or die. But that's not who you are. No, it's who I wanted to be. Whitmore closed the file. Why did you leave the military? Her expression hardened. That's classified. Colonel Davis said something similar. He also said there was an incident in Mosul. An operation that went wrong. Diane's hands clenched. I don't talk about Mosul. You don't have to, but I need to understand why someone with your capabilities, your training, your record, would walk away and hide in a civilian ICU. CU, he paused. What happened over there? She was silent for a long time. Then, quietly, I followed orders. Did everything by the book. And someone died because of it. Someone who shouldn't have. A soldier? An asset. Intelligence operative. Embedded civilian. Her voice was carefully controlled. We were running a medevac operation in Mosul. Hostile territory. Compromised site. I had 3 casualties. One was the asset. Critical condition. Needed immediate evac. Command ordered me to prioritize 2 other wounded over him. Said his injuries were too severe, that we needed to save the ones we could. But you disagreed. I knew I could stabilize him. Knew he had a chance. But orders are orders. She looked at Whitmore. So I followed them. Treated the others first. By the time I got to him, he'd bled out. Died in my hands while I was following protocol. Whitmore's face was grave. That wasn't your fault. Wasn't it? I had the skill. I had the knowledge. I could have saved him. But I waited for permission. Her voice dropped. That's what protocols do. They give you someone to blame when things go wrong. But the person still dies. So you left. I couldn't do it anymore. Couldn't keep making those choices. Thought if I became a nurse, worked in a civilian hospital, I could just follow orders and let someone else carry the weight. But you can't. Whitmore's tone wasn't judgmental, just factual. Because when someone's dying in front of you, you can't not act. It's not in your nature. Diane didn't respond. A knock at the door. Dr. Liu entered without waiting for permission, face flushed. Dr. Whitmore, you need to see this. Not now, Liu. It's about Captain Foster. There's someone here from the Pentagon. Diane went very still. Whitmore stood. What? Military courier. Says he has a classified communication for hospital administration regarding Diane Foster's service record. Liu looked at Diane. What the hell did you do over there? They found the courier in the administrative waiting area. Young guy, Marine Corps dress uniform, holding a sealed envelope with official DoD markings. Christine Vega was already there, looking confused and irritated. What's going on? Vega demanded. The courier came to attention. Ma'am, I have a delivery for hospital administration regarding the service record and current employment status of Captain Diane Foster, U.S. Army Medical Corps, retired. Vega took the envelope. This is highly irregular. Yes, ma'am. I'm instructed to wait for confirmation of receipt and answer any immediate questions. Vega opened the envelope. Inside were several pages of official letterhead, portions redacted. She read in silence. Her expression shifting from irritation to shock to something close to disbelief. Finally, she looked up at Diane. Is this accurate? I don't know what it says. Vega handed her the letter. Diane read. It was from the Pentagon. Office of the Surgeon General. Detailing her service record. 12 years, 3 Bronze Stars, 2 Army Commendation Medals. specialized training in forward surgical techniques, 847 documented combat saves, and then at the bottom, a paragraph that made her breath catch. Recent declassification review of Operation Copper Canyon, Mosul, Iraq, has revealed that Captain Foster's actions during the medevac operation were conducted under compromised intelligence. The asset in question, whose death was previously attributed to combat casualties, was deliberately deprioritized by hostile elements embedded within command structure. Captain Foster followed direct orders from a compromised chain of command. Subsequent investigation has exonerated Captain Foster of any culpability. Her actions are recognized as exemplary given available information at the time. Diane read it twice, then a third time. The words blurred. "They knew," she whispered. "They knew the orders were wrong." Whitmore read over her shoulder. "You were set up." She looked at him, feeling something crack inside her chest. "He didn't die because I wasn't good enough. He died because someone wanted him dead." "And you carried that guilt for 8 months." "Yeah." The courier cleared his throat. "Ma'am, there's a second document, a recommendation from the Surgeon General's office that you be considered for a civilian medical leadership position, specializing in trauma care and tactical casualty training for civilian personnel." Veda stared at the papers in her hands, then at Diane, then at Whitmore. "Dr. Whitmore," she said slowly, "we need to talk. Now." They disappeared into Vega's office, leaving Diane standing in the hallway with the courier and Dr. Liu. Liu looked at her. "Captain Foster, that's going to take some getting used to." "Diane's fine." "I don't think Diane's fine anymore." He smiled slightly. "I think you just became something else entirely." Carter rolled up in his wheelchair. Chair, grinning. "Told you hiding doesn't work, Captain." She looked at him. "Shut up, Carter." "Yes, ma'am." The door to Vega's office opened. Whitmore emerged, his expression unreadable. "Captain Foster, we'd like to speak with you." Diane walked inside. Vega sat behind her desk, the Pentagon letter in front of her. "Sit," Vega said. This time, Diane sat. Vega folded her hands. "It appears we made a significant error this morning. You fired me for saving a life. We terminated you for exceeding your scope of practice, which, given what we now understand about your background, was a profound misunderstanding of your capabilities." She paused. "We'd like to offer you a position." Diane blinked. "What?" Whitmore stepped forward. "Senior trauma consultant, full clinical privileges, authority to intervene in emergency situations at your discretion, and development of a new training program teaching civilian medical staff tactical casualty care techniques." "You want me to train people?" "We want you to do what you do best," Vega said. "Save lives, and teach others how to do the same." Diane looked between them. "Why?" "Because what you did today was remarkable," Whitmore said quietly. "And because people like you don't come along often. We'd be fools to let you walk away." Diane sat in the chair, the offer hanging in the air between them like something tangible. Senior trauma consultant, training program, authority to act. Everything she'd walked away from, wrapped in civilian packaging. "I need time to think," she said. Vega's expression tightened. "How much time?" 24 hours. "We need an answer today. The board meets tomorrow morning, and I need to present this proposal with your commitment." Diane stood. "Then you're going to have to wait. Because I'm not making this decision in a hospital administrator's office 5 minutes after finding out I've been carrying guilt for 8 months over something that wasn't my fault." She walked out before either of them could respond. The hallway was empty now. Most of the emergency had passed, patients either in surgery or transferred to ICU. The fluorescent lights buzzed overhead, casting everything in that familiar hospital pallor. Carter was waiting near the nurses' station, still in his wheelchair. "How'd it go?" "They offered me a job." "Good job?" "Big job. Training program, clinical authority, the whole package." "And you said no?" "I said I need time." Carter studied her face. "You're scared." "I'm cautious. There's a difference." "Is there?" He wheeled closer. "Captain, I've known you for 8 years. Watched you run toward gunfire when everyone else was running away. Saw you perform surgery in a blown-out building while mortars were landing 50 meters away. You're not scared of the work. You're scared of being that person again. Maybe I don't want to be that person." "Too late. You already are." He gestured toward the trauma bay. "That kid today? You didn't hesitate. Didn't overthink it. You just moved. Same as Kandahar. Same as Fallujah. Same as every other time someone needed you and you were there." Diane looked away. I left because I was tired of making impossible choices. No, you left because you thought one impossible choice broke you. But it didn't. Someone else made that choice. You just carried the weight of it. Carter's voice softened. Now you know the truth. So what are you going to do with it? She didn't answer. Dr. Liu appeared from around the corner, tablet in hand. Captain Foster, Ryan Sadowski is out of surgery. They want you upstairs. Why? Because he's asking for you. The surgical ICU was quieter than the emergency department, but the tension was the same. Machines breathing for people who couldn't breathe themselves. Monitors tracking heartbeats that needed tracking. Diane had spent years in spaces like this. Different countries, same struggle. Ryan was in Bay 3, intubated, sedated, but stable. The surgeon, a woman in her 50s named Dr. Patricia Chen, stood at the bedside reviewing charts. She looked up when Diane entered. You're Foster. Yeah. You're the one who stabilized him downstairs. Yeah. Chen set down her tablet. That was remarkable work. The rebar was 2 millimeters from the pulmonary artery. As it had shifted during transport, he would have bled out before we got him on the table. Your stabilization technique saved his life. I just did what needed to be done. No, you did what very few people could have done. I've been a cardiothoracic surgeon for 26 years. I've seen battlefield trauma. I've consulted with military physicians. What you did downstairs was special operations level medicine in a civilian emergency department. Chen paused. Whitmore told me about your background. He also told me about the training program they're proposing. I haven't accepted yet. Why not? Because I'm not sure I want to go back. Cut to being who I was. Chen looked at Ryan, unconscious and alive. You think that's who you were? Someone who saves lives under impossible circumstances? Someone who makes life and death decisions that break people. Every surgeon makes those decisions. Every emergency physician. Every ICU nurse. The difference is most of us make them with time, resources, and institutional support. You made them with none of those things and still saved 847 lives. Chen met her eyes. That's not something to run from, Captain. That's something to build on. Diane looked at Ryan. The rise and fall of his chest, mechanical but steady. The monitor showing a heart that was still beating because she'd refused to let it stop. He's 19, she said quietly. Yes. Same age as some of the soldiers I treated. Kids who should have been in college, not bleeding out in the desert. But this one isn't in the desert. He's here, safe, because of you. Chen picked up her tablet. Think about the offer. But think about this too. How many more Ryan Sadowskis are out there? How many could be saved if more people knew what you know? She left Diane alone with the kid and the machines. Diane stood there for a long time, watching Ryan breathe, thinking about Mosul, about the asset who died, about the 8 months of guilt she'd carried like a stone in her chest. The guilt hadn't been hers to carry, but the knowledge was. She pulled out her phone, dialed a number she hadn't called in 8 months. It rang 3 times. Then, Captain Foster, I was wondering when you call. Lieutenant Colonel Davis, the voice that had tracked her transition to civilian life, that had called during the construction accident, that had apparently arranged for a Pentagon letter to arrive at exactly the right moment. You knew, Diane said, about Mosul, about the compromised orders. You knew, and you let me walk away believing I'd failed. The investigation was classified. We couldn't tell you until the review was complete. 8 months, Colonel. I spent 8 months thinking I'd killed someone. I know, and I'm sorry, but the alternative was telling you that your chain of command had been penetrated by hostile intelligence, and that speaking about it could compromise ongoing operations. His voice softened. You did nothing wrong, Captain. You followed orders. That's what we asked you to do. And someone died. Someone was killed. There's a difference. You were the weapon. Someone else pulled the trigger. Diane closed her eyes. That doesn't make it easier. No, but it makes it true. A pause. I hear you've been offered a position, training program, civilian application of tactical medicine. How do you know that? Because I recommended it. Called Christine Vega personally. Told her that letting you go would be the biggest mistake St. Michael's ever made. Why do you care? Because tactical combat casualty care saves lives. Military lives, yes, but civilian lives too. Mass casualty events, terrorist attacks, natural disasters. The skills you have, the knowledge you carry, that doesn't just belong on a battlefield. It belongs everywhere. People are bleeding, and someone needs to stop it. Diane opened her eyes, looking at Ryan again. I don't want to command people. I don't want to make impossible choices. Then don't command. Teach. Share what you know. Let other people make the choices, armed with the skills you give them. Davis's tone shifted. You've spent 12 years being the person who acts. Maybe it's time to be the person who empowers others to act. The line went quiet. Think about it, Captain, but think fast. The world doesn't stop bleeding while you decide. He hung up. Diane stood in the ICU, phone in hand, surrounded by machines and medicine and the quiet hum of organized survival. She thought about the kid in front of her, about Mr. Abrams in room 8, about the 847 others whose names she carried. She thought about the asset in Mosul, whose death hadn't been her failure. And she thought about Carter's words, too late, you already are. She walked back downstairs. Whitmore and Vega were in the conference room, papers spread across the table. They looked up when she entered. I have conditions, Diane said. Vega gestured to a chair. Sit, let's hear them. Diane remained standing. First, I train everyone. Nurses, residents, attendings. No hierarchy in my program. If you want to learn, you're in. Agreed, Whitmore said. Second, I have full autonomy in emergency situations. If I say someone needs intervention, I don't wait for committee approval. Vega hesitated. That's a significant liability risk. That's the deal. You hired me because I save lives. Let me do it my way. A pause. Then Vega nodded. Agreed, within reason. Third, we establish a protocol for mass casualty incidents based on military triage principles. Fast, efficient, focused on saving the maximum number of lives. I'll work with you on that personally, Whitmore said. Diane took a breath. And fourth, we never give up on a patient while there's still a heartbeat. I don't care what the textbook says. I don't care what the statistics say. If there's a chance, we take it. Whitmore smiled slightly. That's already in our mission statement. We just don't always live up to it. We will now. Vega stood, extended her hand. Welcome to St. Michael's, Captain Foster. Officially this time. Diane shook it. The grip was firm, businesslike, and somehow final. She'd just agreed to step back into the person she'd been running from. Except she wasn't running anymore. 2 weeks later, Diane stood in a converted conference room that had been transformed into a training space. Mannequins, medical equipment, simulation monitors. 15 staff members sat in chairs facing her. Nurses, residents, 2 attending physicians, even a paramedic from the local fire department. Dr. Liu sat in the front row, notebook open. Carter, cleared for limited activity, sat near the back, grinning. Whitmore stood at the side of the room, observing. Diane looked at the faces staring at her, waiting. She took a breath. My name is Captain Diane Foster. For 12 years, I worked as a special operations combat medic in Afghanistan, Iraq, and Syria. I performed 847 medical interventions under hostile conditions. I've done surgery in buildings that were actively being shelled. I've treated patients with supplies I scrounged from abandoned aid stations. I've made decisions in seconds that most of you get hours to consider. She paused. I'm not here to teach you to be soldiers. I'm here to teach you to save lives when everything goes wrong, when protocols fail, when resources run out. When the textbook answer isn't enough. She looked at each of them. I'm here to teach you to be enough. Someone in the back raised a hand. A young resident. What if we're not? Then you learn. You adapt. You become it. Because the alternative is watching someone die when you could have saved them. And I promise you, that's a weight you don't want to carry. The room was silent. Diane picked up a scalpel. Let's begin. 6 months later, St. Michael's. Michael's Regional Medical Center looked different. Not in architecture or layout, but in rhythm. The emergency department moved with a new efficiency. Staff trained in tactical triage principles, everyone knowing their role when chaos arrived. And chaos still arrived. It always did. Diane stood in the simulation lab, watching a third-year resident named Rebecca Marsh perform a needle decompression on a training mannequin. The movement was clean, confident, angled correctly. 2 months ago, Rebecca had frozen during her first real tension pneumothorax. Now her hands moved without hesitation. Tied, Diane called. Rebecca stepped back. 2 minutes, 40 seconds. Good. Do it in 2. 2 minutes isn't realistic. It is when someone's dying. Diane reset the mannequin. Again. Rebecca nodded and started over. Dr. Liu entered the lab, tablet in hand. Captain, you have a visitor. I'm teaching. I think you'll want to see this one. Diane handed the training scenario to another instructor and followed Liu into the hallway. Waiting near the nurse's station was a young man in jeans and a flannel shirt, looking healthy and whole. It took her 3 seconds to recognize him. Ryan Sadowski, the construction worker with rebar through his chest. The kid who should have died 6 months ago. He saw her and smiled. Captain Foster. Ryan. She walked closer, studied his face. Color good, breathing easy. No visible distress. How are you feeling? Good. Great, actually. He gestured to his chest. Got a hell of a scar, but the doctors say I'm fully healed. Back at work last month. Construction work? Yeah, different site though. Can't look at rebar the same way anymore. He laughed, nervous but genuine. I wanted to thank you. They told me what you did. Said I shouldn't be alive. You're a fighter. You did half the work. No, ma'am. I was just trying not to die. You're the one who made sure I didn't. He pulled out his phone, showed her a photo. A young woman holding an infant, both smiling. My girlfriend. And our daughter. She's 3 months old. Born 2 months ago. Diane looked at the photo. The baby had Ryan's eyes. I almost wasn't here for that, Ryan said quietly. Almost missed meeting my own daughter. Because of a stupid accident. But you gave me that. Gave me the chance to be a father. His voice cracked slightly. So thank you. I know that's not enough, but thank you. Diane felt something tighten in her chest. What's her name? Diane. We named her Diane. The hallway went quiet. Ryan smiled. Seemed right. She's alive because you kept me alive. Felt like the least we could. I'll do. Diane didn't trust herself to speak for a moment. Then, that's a good name. Yeah, it is. He pocketed his phone. I won't take up more of your time. Just wanted you to know what you did mattered. Still matters. Every single day. He shook her hand and left. Lou stood beside her, watching Ryan walk away. You okay? Yeah. That's the 14th patient who's come back to thank you. You're collecting then. I'm just doing my job. Your job is saving lives in ways most people didn't know were possible. That's a little more than just a job, Captain. Diane returned to the simulation lab. Rebecca was on her 4th attempt, timed down to 2 minutes, 10 seconds. Progress. Slow, incremental, but real. That afternoon, Diane received a call from Lieutenant Colonel Davis. Captain Foster, I have news. The Department of Defense is interested in your training program. They want to implement a modified version for military medical personnel transitioning to civilian roles. Standardized curriculum, national rollout, full funding. Diane sat down. That's a big project. It is, and they want you to lead it. Design the program, oversee implementation, train the trainers. It's a 3-year contract, civilian consultant position, significant budget. I already have a job here. You'd keep it. This would be additional. Weekend seminars, online modules, quarterly training events. St. Michael's would become the flagship site. Davis paused. You'd be impacting thousands of medical personnel, Captain, potentially saving tens of thousands of lives downstream. Diane looked out her office window at the emergency department below. Staff moving efficiently, protocols in place, training paying off in real time. Send me the proposal. I'll review it. Already sent. Check your email. She opened her laptop. The proposal was massive. Detailed, ambitious. Tactical combat casualty care for civilian medical personnel. A national training initiative. Her name listed as program director and lead instructor. She read through it slowly. Curriculum development, training standards, certification protocols. Everything she'd learned over 12 years, systematized and scaled. It was overwhelming. It was perfect. A knock at her door. Whitmore entered without waiting. I just got off the phone with the Department of Defense. They're serious about this national program. I know. Davis just called me. What do you think? I think it's too big for one person. Good thing you won't be one person. They're offering funding for a full team. Instructors, curriculum designers, administrative support. You'd be building something from the ground up. Whitmore sat down. 6 months ago, you didn't even want to be here. Now you're talking about a national program. 6 months ago, I was running from who I was. And now? Diane looked at the proposal on her screen, thought about Ryan and his daughter, about Mr. Abrams, who'd sent her a thank you card every month, about Rebecca learning to move without fear. Now I'm running toward who I can be. Whitmore smiled. Then say yes. 3 months later, the first national training seminar took place at St. Michael's. Medical personnel from 17 states attended: nurses, physicians, paramedics, even some hospital administrators. The converted conference center was packed. Diane stood at the podium, looking out at 140 faces. My name is Captain Diane Foster. I'm going to teach you how to save lives when everything is on fire. The room leaned forward. She clicked to the first slide. A photo of a trauma bay, blood on the floor, equipment scattered. Real, unfiltered. This is what chaos looks like. This is what you're going to face when the mass casualty hits, when the protocols fail. When you're the only person standing between a patient and death. And I'm going to teach you not just to survive that moment, but to master it. For the next 3 days, she taught. Demonstrations, simulations, hands-on practice. She brought in Carter, now fully recovered, to share the patient perspective. She brought in Dr. Chen to teach surgical decision-making under pressure. She brought in Lou to discuss team dynamics in crisis. By the end, every attendee had performed procedures they'd never imagined doing. Every one of them left different. One participant, a young nurse from Ohio named Marcus, approached her after the final session. Captain Foster, I've been a trauma nurse for 5 years. I thought I knew what I was doing. But this weekend changed everything. You didn't just teach us techniques. You taught us to think differently. That's the point. Techniques fail. Thinking adapts. I'm going back to my hospital and starting a training program based on what you taught us. Diane handed him a folder. Curriculum outline. Simulation scenarios. Contact information for equipment suppliers. Everything you need to start. Marcus stared. Ed at the folder. You're just giving this away? Knowledge doesn't save lives sitting in my head. It saves lives in your hands. She met his eyes. Go teach someone else. Pass it forward. He nodded, gripping the folder like something sacred. That night, Diane sat in her office, reviewing feedback swarms. 97% rated the training as excellent or outstanding. Comments ranged from life-changing to exactly what civilian medicine needs. One comment stood out. I always thought military medicine and civilian medicine were separate worlds. Captain Foster showed me they're the same world, just different contexts. She didn't teach us to be soldiers. She taught us to be better at saving lives. That's universal. Diane printed the comment and pinned it to her wall. Her phone rang. Unknown number. She answered. Foster. Captain Foster, this is Dr. Sarah Chen from Johns Hopkins. I attended your seminar last month. I'm calling because we're facing a situation here, and I think we need your help. What kind of situation? Multi-vehicle accident on I-95. 12 critical casualties incoming in the next 20 minutes. Our trauma team is excellent, but we've never handled this volume simultaneously. I remember what you said about surge capacity and dynamic triage. A pause. Can you walk us through it, right now? Diane stood, grabbed her tablet. Put me on speaker. Get your team assembled. Let's go through your resources. For the next 18 minutes, she guided them through setup. Triage stations, supply positioning, role assignments, communication protocols. Everything she'd learned in forward operating bases, translated for a civilian emergency department. When the casualties arrived, Johns Hopkins was ready. 3 hours later, Dr. Chen called back. All 12 patients stabilized, 0 preventable deaths. Your protocols worked perfectly. Her voice was thick with emotion. You just saved lives from 800 miles away. You saved them. I just gave you the framework. No, Captain. You gave us the confidence to act. That's worth more than any technique. After she hung up, Diane sat in the quiet office, looking at the city lights outside. Somewhere out there, 12 people were alive who might not have been, and she hadn't touched a single one of them. That was the power of teaching. Multiplying impact. Creating ripples. She thought about the asset in Mosul, the guilt she'd carried, the weight she'd finally put down. Some doors close, some open. The important thing was knowing which ones to walk through. A trauma alert sounded overhead. Mass casualty incident, incoming. Diane grabbed her gear and headed for the emergency department. Dr. Liu met her at the door. Factory explosion. At least 8 casualties. Could be more. Who's on triage? Rebecca. She requested lead. Diane smiled. Rebecca, who'd frozen 6 months ago, was now requesting command. Let her run it. We'll back her up if needed. They entered the trauma bay. Rebecca stood at the center, calm and focused, directing staff with quiet authority. When the first ambulance arrived, she moved without hesitation. Diane watched from the side, not interfering. Whitmore appeared beside her. She's good. She learned fast. She learned from the best. He glanced at Diane. You've changed this place, Captain. Changed how we think, how we act, how we train. St. Michael's survival rates are up 23% in trauma cases. That's unprecedented. That's teamwork. That's leadership. Whitmore crossed his arms. For what it's worth, I'm glad I was wrong about you. Glad you proved me wrong. You weren't wrong. You just didn't have all the information. Neither did you, about Mosul, about yourself. He paused. But you figured it out. That takes courage. Diane watched Rebecca stabilize a patient with a tension pneumothorax. Needle decompression, smooth and fast. 2 minutes flat. It's not courage. It's just deciding that hiding doesn't work. Isn't that the same thing? Maybe it was. The emergency department hummed with controlled chaos, staff moving like a machine, every person knowing their role. Lives being saved in real time, not by one person, but by a system. By knowledge shared and skills multiplied. Diane's phone buzzed. Text from Ryan. Diane just smiled for the first time today. Thought you'd want to know. Attached was a photo of the baby, grinning toothlessly at the camera. Diane saved the photo. Somewhere in the trauma bay, Rebecca called for a surgical consult. Her voice was steady, confident, absolutely certain. Diane smiled. This was what winning looked like. Not glory, not recognition, but quiet competence rippling outward. One patient, one student, one moment at a time. The work continued. It always would. And for the first time in 8 months, Diane Foster was exactly where she was supposed to be. Not hiding from who she'd been. Building on it.